Hi, my name is Victoria. I am currently a GP. I graduated from university in 2014, so this year will be my 6th year out of uni. I always wanted to be a GP since I was a medical student. I definitely did go through the usual things that other medical students thought. Wanted to do psychiatry. When I did psych term, I wanted to be a paediatrician, and I sort of realised that I just really enjoyed doing general medicine. So I think general practice was definitely the right choice for me. I've never regretted it, and that's why I still work in general practice. So I work in general practice part-time. And with the other half of my time, I actually work as a risk advisor at Avant. Now, Avant is the largest medical indemnity insurance company, I suppose, across Australia, and covers more than 50% of doctors. And I hope you all have your own indemnity. But basically what my role at Avant is, I see it as being the equivalent of primary care or general practice, or primary care for doctors. And our role is to support doctors and medical students to, one, practice safely, and to support them, I suppose, in terms of identifying risks in their work and how we can help mitigate them. How I found myself in this role was during my training in general practice. One of the final terms in general practice, we do what's called an extended skills term. It's sort of like advanced training in other specialties. And you can choose an area of interest that could be skin cancer, cosmetics, medical legal work, and that's how I sort of found myself in that role. I have no prior experience in law or any legal sort of work, but it's been a really nice sort of non-clinical challenge, I suppose, and it works really well with my clinical work. So here with me, I've got one of my colleagues, Daniel. He works with me in GP, and I might get him to introduce himself.
Hi, how you going, guys? So I'm Daniel Chanisheff. I'm a GP. I graduated medical school in 2009 and had a little bit of an exploratory phase following that of trying lots of different specialties. I managed to travel around Australia working predominantly in ED, and in the very understaffed ED, I was promoted to ED registrar, which then upped my skills, and I became sort of ICU, semi-ICU trained at a lower level, so I was able to work in ICUs around Australia as well. But having travelled around and doing a lot of acute care medicine, I decided I wanted to have more patient contact time and sit down in a single place and work. So I decided to move to Sydney and pursue my general practice training. I had done 6 months at a time of renal, orthopedics, cardiology and all these other fields. And in the end, the one thing I realized was that continued patient contact and the variety of medicine were the two things that I needed to keep going in a career in medicine. So I moved to Sydney and I started my GP training, I think when you finished medical school, so 2014. And I fellowed in 2017, doing some extended terms in skin cancer medicine and cosmetic medicine. And I opened my own practice because I wanted to, essentially, if I was going to do medicine for the long term, I wanted it to be done right, and to be done in a safe way, and to be done, not really compromising things. So I didn't find I could work for someone else and do that. So I opened this practice here in 2016, and here we are 4 years in the current pandemic at the moment. But because I was able to control all these things, I'm able to work safely now because I know that, we've put processes in place. So yeah, my job is in general practice, and a lot of people think that that's just seeing patients with cough, colds and flus and sending them on to specialists. And
medical certificates.
Yes, and there is a lot of that, of course. But the biggest and most rewarding thing here is seeing people through their journey. And you get to meet a lot of people along the way that, throw real curveballs at you. And if you're a good, diligent general practitioner who keeps up with ongoing study and what's up to date, you can do some amazing things for your patients. You'll achieve great outcomes for people much earlier. You'll literally save lives, and we see that here. And I think general practice can be this good. It can be bad, but so can every other specialty. But if you do it well, you find yourself around the right team, it's a super rewarding career path, in my opinion. Yeah.
And I would really agree with that. One of the real benefits or positives for me in general practice is in no other specialty will you get to see a patient in their unit, their family unit, from sometimes birth. In fact, in utero. You know, you will look after a pregnant woman when they first become pregnant, then they deliver, you look after their baby, you look after their mum, and you look after the entire family. And that to me is the true definition of what continuity of care is. And I think that's why we both love general practice and still do it, despite having to socially distance currently at 1.5 meters.
We've got the stick and 1.5 meters from surface to surface. So yeah, we're doing good.
So Daniel, maybe you could talk to us about some of the challenges that you've sort of come across in general practice, and maybe some of the traits you've seen in other doctors.
I think one of the biggest challenges in general practice is that there's a lot more uncertainty than other fields of medicine. Because other fields of medicine have a more narrow focus, you can easily define what falls within your scope of practice and what doesn't. So often you'll see this in hospitals is when something falls outside your team's scope of practice, there's another team that can look after that particular thing for you. And in general practice, while that's true as things become more acute and more severe, in the early stages of most diseases, you don't have that straight away. At least a good general practitioner shouldn't have to rely on that as a crutch. So one of the challenges is learning to deal with the variety and having a safety net of dealing with uncertainty. So being able to deal with things that aren't quite clear yet and making sure you're moving in the right direction in terms of progress, diagnosis, and treatment, while still keeping the patient and yourself safe, is a difficult thing for new general practitioners. And over time, with increased training, with increased exposure, and excellent clinical teams, people seem to get really good at this. But I think that was one of the most difficult things that I faced as a GP reg. And I'm kind of refacing that now in this crisis, because this is a disease we know nothing about. And all those old feelings come back to you, but I think we're put in a good position of, well, let's safety net these people first, you know, so yeah.
And I would really echo that. I mean, I think dealing with uncertainty is not something that we learn in medical school, and it's something I wish that I did learn, but possibly it's with experience that you learn how to deal with it. And I think in medical school, we learn a lot about, you know, this is a symptom, what's your provisional diagnosis? And although we do have that as a beginning when we think about it, you just have to get comfortable with knowing that not everything presents like it does in a textbook, and you have to be comfortable with being able to send them away, review, and review again until you get that sort of diagnosis. So it's a really different way of thinking, and it is very challenging on most days.
Yeah, it can be really challenging. Like 1 or 2 tricky cases a day can just mentally drain you. Yeah.
In terms of some of the traits that I've seen in, you know, doctors before me and that sort of thing, I think one of the really positive things I've seen in other colleagues in their career choices is passion. And I think that you need to, whatever you decide that you want to do, be really passionate about it. You might not know that that's what you want to do, but give it a try, give it a go. And if that's what you want to do, then you've got to really pursue that passion. You know, you can't do anything half-heartedly. And I think one of the drawbacks I've seen in some doctors and is the lack of empathy. I've seen, you know, time and time again with patients, what is the most important thing in clinical care is listening to them and really understanding, you know, their needs. An example I would give would be, you know, I have a young patient with Crohn's disease, and she was going for some pretty big abdominal surgery. Now, the surgeon was obviously fantastic, but when I chat to her about her thoughts and her feelings, what really resonated with me was the fact that she said to me, I'm young, I'm 25. My biggest worry is the big scar on my tummy, not about the, you know, the complications of a leak or needing re-surgery. And I think that's why I really urge you as future doctors to really listen to your patients and listen to what their worries and concerns are. What about you, Daniel?
I agree. I think although as medical professionals we see a lot of grim stuff and a lot of people at their worst, and we have pretty dark humor ways of coping with things within our own circles, it's really important not to forget that empathy and to remember that the patient in front of you is a person with their own life, and the things that are going on in their lives really affect them. And drilling into that concern is what makes you build that connection with the patient. And when you build a connection, you get a better outcome. So yeah, I agree. I think, you know, there's million and one examples. I recently had to diagnose someone with metastatic testicular cancer, which is pretty terrible. And he came in with, you know, he's a 25-year-old with low back pain. You know, he didn't even have a lump on his testicles to begin with. So he had metastasized pretty early. But listening to his concern, I could tell this guy was more concerned about the back pain than usual. And if we hadn't connected on that, look, what's really bothering you? And finally he came out and said, look, I don't think this is mechanical back pain. I think it's worse. If we didn't chat for a bit longer and he didn't say that, I would have just said, yep, look, it's mechanical, it makes sense, go see the physio, let's do it. But investigating a little bit earlier meant that he was able to get treatment. Hopefully things prove to be a better outcome. But I truly believe that empathy makes all the difference into making you a better doctor.
What mistakes have you made along the way?
I don't want them on film, but well, I think one of the mistakes is, when you're tired as a medical student or a registrar or RMO, you kind of go, I'll deal with that later, I'll learn later, I'll seek those opportunities out later. I think I did seek out a lot, but I do regret the opportunities I didn't seek out. So I think in emergency, I put my hand up for all the procedures, and even as an intern, they let me do things like chest drains and help with intubations because I was so keen. And that helped me out in my locum years, which now makes me much more comfortable dealing with severe cases that present here. Okay, this has to go and this is not so bad, we can manage it. My regret is not doing that more for the specialties I found tough. And specialties I found tough as a med student and an intern and all that were peds and ONG. And as a GP, you get very good at them. It was just harder to get good at them because I didn't seek out those opportunities earlier. Yeah.
I would really agree with that. I think no matter what specialty that you've got your heart on, I think probably the most important thing is that take those learning opportunities to heart when they come to you. They're free. The learning is free. Afterwards, you have to pay for every postgraduate diploma and every course that you do, and immerse yourself in even the specialties that you think are not helpful. My psychiatry term, I felt like I could have learnt more. And in every specialty that you do, there is always going to be some mental health. There's always going to be some things to deal with. So I think you can always pick up some real pearls in whatever you do.
Yeah. And if you think about all the regs and all the consultants you've met, the ones that impress you the most are the ones with the breadth of knowledge. Like an orthopedic surgeon who knows how to deal with acute pancreatitis. That blows your mind, right?
Yeah.
Like it's incredible. So yeah.
Yeah, and I guess finally, Daniel, what would be some advice you would give to yourself when you were a medical student, or something you wish you were told?
Okay. That was a hard one. Medically, I would say the thing I said before, which is pay more attention and give more effort to the learning opportunities. You take it as it comes, but I think for young doctors, being financially savvy is actually really important. I think we are prime, easy targets for marketing companies and loan companies to come and say, here's some free loans, you're going to be a doctor, you're going to make $1 million. And of course, we're too busy often to then look properly at our finances because the money comes in. But be careful, with all that, and try to become financially savvy earlier. Understand how the health system works, because it might be a little while away, but you're going to get in it, and all that knowledge is going to arm you to be a better doctor if you understand how everything works financially as well. You can then do things that are better for your patients, better for your business, better for your own family. The medicine will come, the finances we don't get taught, and I think it was a steep learning curve for me down the track, yeah.
I think for me personally, one of the things that I wish I was told was probably how difficult this path is going to be. I think a lot of us enter medical school very young, impressionable, not sure what we want to do. And it is a really long journey ahead, and it is a long journey of learning, and it doesn't get any easier, which is why it is so important to find yourself in a specialty that you really love. And it's not just that you love, but it works with your life.
Yeah.
Personally, I did choose general practice partially for the lifestyle aspect. I do like being able to go home at a reasonable hour and do the things that I enjoy out of medicine. And you've got to ask yourself that when you are choosing what you want to do.
Yeah, that's important. I know a lot of people say that GP is a lifestyle choice, and it can be. And that doesn't just mean a lifestyle of easy living 9 to 5. It means a lifestyle of whatever you like. So for me, that's being able to own a business was very important to me. For me, being able to help more than one person at a time. In most other specialties, you can only help the person right in front of you until you become a director of a department maybe, or a public health physician. But in general practice, I get to help a whole community by making something that's, an easy place to work for other doctors as well. So for me, there were two very important things. And yeah, really be honest with yourself about what you want out of your life before you jump into a specialty. For people who play poker, don't become pot committed. I think, just because you invested time into a training specialty or into a particular pathway, don't tie yourself to that forever, because it is hard, and it only gets harder if you're not getting into that specialty. It becomes much more difficult down the track. So have an open mind about medicine. Yeah.
Yeah. So I guess in summary, I mean, hopefully that's helpful in terms of thinking about what you want to do in the future, but the world really is your oyster. There are so many options. You don't even have to actually do medicine as well. I think that's another thing to sort of say. I think, yeah, have an open mind and don't just get stuck in one pigeonhole, because, I mean, all of us are finding ways to do other things with our time. And look, we're always happy for any questions, any emails, you know, bounce them through.
Excellent. Yeah, I'm happy to be contacted with any questions people have as well. So yeah, thanks Vicky for asking me to be a part of this video.
Thank you.
See you later. I hope that recorded.